Hi, everybody. I want to welcome you to the 7th International Summit on the Future of Health Privacy. And I want to start by thanking you so much. This is the 7th summit. Can you believe that? For all these years now, we've been coming together and trying to look at the most important issues in health and in technology, the intersection. And so we couldn't do this without your support, without the word of mouth that you spread about the quality and the content that our fabulous speakers donate to us every year. And this year, again, I think every time I come to this podium for a summit, I am amazed at the help and the cooperation of all of these amazing, amazing people working in this complicated area. You know, their willingness to come and help. And even this year, we have, I think probably, each year it's better and better. I think this year is the best yet. And it's kind of scary because how can things keep getting better? But they get better because of you and your support. And I want to particularly point out our sponsors, Microsoft, fair warning, Quintiles IMS, DIN, the Delaware Health Information Network, DigiMe, and Ananos. These are brave companies, right? These are brave companies because they believe not everything that advocates believe, but they all support the importance of actually looking at all sides of the issue. So what we try to do, and I think you know this, is we try to have privacy experts from industry, top government officials, and we're thrilled. I think you know tomorrow we have the first public, as far as we know, public speech by the Assistant Secretary for Health Information Technology Reform, Dr. Fleming, who's formerly a representative from the state of Louisiana, and he was a family doctor. So we have, but the point I was trying to make about our industry supporters is this is so different than any type of health technology conference where, you know, the back page is covered with hundreds of donors. And so the people that support us from industry are very special because they believe that these discussions need to be held, and we're very grateful to you for supporting us in that way. It's very important to us. We couldn't do this without you. And I'm going to talk a little bit about the title of our summit this year. Is health privacy a human right? I'm going to talk a little bit about my own journey in that route, and you will see that I only came to human rights late, and one of the things that's going to be so exciting today is the experts that we really have coming here to talk to you about human rights. Anna is, oh, there you are. I'm sorry. We're going to have a few words of welcome from Georgetown Law Center and the ONeill Institute, on behalf of ONeill Institute for National and Global Health Law, who are our gracious hosts. And everyone talks about what a lovely setup this is here, this particular space. It's so convenient. It's everyone, you know, it's intimate, but everyone can see. It's an auditorium style for those of you who are watching but not here. Auditorium style, I mean, what do you call it? Amphitheater style auditorium. So it's kind of creates an intimacy between the speakers and the audience. And so we hope you will all have lots of questions. We hope you will enjoy, in particular, the great, incredible speakers that we have for you starting this morning on the new European General Data Protection Regulations. So that's going to be very, very special. And we also have a German scholar and researcher that has, I think, probably the most comprehensive background in research, and has been the principal investigator in 22 European research projects and 25 national research projects. I mean, his track record is amazing, and he's a director at it's L3S. Yes, it's a European organization of researchers on essentially making the web the kind of place we need it to be. So these are, we are just so deeply honored that they are going to share with us today. And why don't, would you like to come up and say a few words on behalf of this institution that we're so grateful for hosting us all these years? Anna, please introduce yourself.
Yes, of course. It's actually our pleasure to have you here and to have been able to host this conference for 7 years, as you said. So I'm here basically to represent the ONeill Institute for National Global Health Law, an academic institute within Georgetown Law. And I am the director of the Global Health Law LLM program. And for those who don't know what an LLM is, it's a Master's of Laws. And the LLM program itself is a very important part of the mission of the ONeill Institute. And the whole mission of it is, how do we, as lawyers, highlight the role of law, the role of lawyers in the public health space, whether you're talking about at the domestic level or the global level. So that is what our work does, and this is certainly a part of that. And what we like to do as the ONeill Institute, situated within Georgetown Law, is to really bring together different perspectives, people from different sectors, in order to advance these debates that need to happen. And that's why we are so proud to be able to host this conference. And we do wish that as you're here today, and any future conferences that you attend, and hopefully many years, that you really take advantage of everyone who's around you, that you really learn from the experts that come to talk at this conference and really share with you all the experience that they have to offer, essentially. And yeah, I think this is a way to just broaden the network and really highlight what we can do around the issue of privacy as a human right. So welcome on behalf of the ONeill Institute, and enjoy.
Actually, could you hand me that little pad of paper? Thank you. I appreciate it. Okay. So if you'll bear with me a little bit, I'm going to inflict myself on you for a few minutes. This year, so much has changed on our planet, and human rights are really at the fore, not just in healthcare, in so many ways. So many people's lives are at stake. Do you have a right to live? I think that maybe takes precedence over a right to privacy, a right to life, but certainly human rights are very, very important. And it's been kind of a journey for me. And so I'm looking very much forward. Today, we have many experts that are speaking, and many of you in the audience are experts, in fact, on human rights. And so we're going to hear a lot about that. Americans are familiar with civil rights, with, our education system is kind of lacking. I don't think most people haven't had any formal education in human rights. And so I never, when we started this organization, I never thought that this was an area of human rights. It started for me really with medicine and with Hippocrates and the Hippocratic Oath. And so the connection between ethics and human rights, I think you're going to hear a lot about that today. That'll be very important for me to learn, and I hope for you too. It'll be fascinating, I think. But I've been, many of you know this, I've been a physician for, over 40 years. I was very fortunate to get into medical school At the time, it was affordable in the paper age. Education wasn't big business either. Tuition for medical school was, I forget if it was $482 a semester or a year. But, you know, almost any family could cobble that together. You could, you know, kind of work for that money yourself over the summer. So lots of things have changed. Some of them for the better, some not. But I wanted to start with really the Hippocratic Oath and remind you of what it's about. It's a pledge to help train other physicians, train a duty to train other physicians. It's not about physicians' rights, it's about physicians' duties, to train other people, to teach other people, to keep patients from harm and injustice. That's the translation from the Greek, injustice. And we're to provide for the benefit of the sick. Patient first. That's if you want to boil down the AMA Code of Medical Ethics, it's patient first, you second. We have to do our very best for each patient. It's a very personal duty, and it's founded on trust. And the trust comes because the part that you all know about, the pledge that whatever we hear, inside treatment or outside treatment, inside or outside, I only emphasize that because now, as we know, health information and everything about your mind and body is outside of healthcare in very powerful ways too, and our pledge is to keep it to ourselves. Why is that? I mean, to me, it's about trust. And some of you may have heard me joke before. You know, really, I ended up sort of moving into this because I saw what happened to HIPAA in 2003. Our rights of consent were taken away. The data holders essentially got regulatory permission, that's the phrase, to use and disclose your protected health information for treatment, payment, and healthcare operations. It essentially legalized the control, the sharing, the selling of our data to many entities that we still don't know about. I'll put in one little plug here for something that didn't happen. One of the things that our bipartisan coalition for patient privacy got into the stimulus bill in 2009 was a right to an accounting of disclosures of everything from hospital electronic health records, accounting for disclosures. That was a compromise with Congress. They would not define the word privacy in healthcare, and they would not restore the right of consent. So we were supposed to get, what is an accounting for disclosures about? It's transparency and accountability, right? I think it's 9 years, am I doing my math right? Is it 8 or 9 years? How many years has it been since high-tech was passed and okay, thank you. I'm nervous, I can't count. So it's 8 years, we still have no accountability or transparency. Zero. And I know that that's part of why you all are here to hear more about the data map from LaTanya Sweeney tomorrow and from her fabulous team of students here today, because that's a question she'd asked, and it's a foundational question for every nation. No nation has a map of where all our personal data flows. Even the Europeans, I would say, don't know everywhere that it goes. So we have to consider what effects this lack of privacy has. You know, physicians cannot keep your information private. And so that's why I started this organization. I couldn't get organized medicine to do it. I couldn't get the psychiatrist to do it. I couldn't get the psychoanalyst to do it. And so finally I thought, well, who cares about this anyway? And I believe that you all care. I believe that everyone cares about it. And so all the polls have shown that that's true. About 95% of the public thinks they should control their health information. And so we jumped off a cliff and started this organization. One of the things I want to point out to you today in my welcome in the program is I did something you're not supposed to do. I listed some actual articles that I think are relevant to this. So for example, did you all see The Economist? The world's most valuable resource is no longer oil but data. It had that sort of beautiful picture of the ocean with oil rigs, and the oil rigs were named. Can you guess what the names were? Anybody?
Amazon.
One?
Google.
Yes.
Facebook.
Yeah, exactly. Yes. And so it was, it's really hard to think of how do you picture what's going on, and I thought that was pretty clever. So these are some pretty interesting stories, but there is a coming together from across many places of the realization that we're in a kind of a state of surveillance capitalism, using surveillance, capturing information is the critical business model of the major internet companies right now, and we have to look at that. So speaking of having to look at that, did anybody notice that Mark Zuckerberg gave a commencement talk at Harvard this year? Okay, so you can guess which part I scanned it for. What on earth, if anything, did he say about health? And here it is. We need to, he had thoughts about what we need to do now is we need to cure all diseases. And we have to do that by voluntarily, and he did say asking people to volunteer to track their health data and share their genomes. And so he moved on to say, today we spend 50 times more treating people who are sick than finding cures so people don't get sick in the first place. That makes no sense. Well, I had a lot of trouble with that as a physician. I mean, first of all, maybe it's because of my age. Does anyone actually think that we're going to be cured and not have diseases and not die? I mean, being sick is part of life. It's part of life. So we're going to cure all diseases. Is that naive, or is it denial, or is it that he's just young and imagines he can do anything, and there's some kind of utopia with no disease? I think the geneticists would tell us that that's pretty hopeless. So I guess what I want to leave you with is I think the key reason that we're moving from ethics and Hippocrates to human rights and the human right to privacy is today we actually have no trust among the public in the US of health technology. So there was a poll January 3rd, and fully 89% of the public withheld. It was a poll of 12,090 people, adults, and their ideas and attitudes toward health technology and electronic health records. And 89% of people withheld data, withheld important information from the people that they're hoping will be able to help them. That's crazy. I'll get to say that because I'm a shrink. That's crazy. Okay, so in 2005, the California Healthcare Foundation did a similar study, like, are any of you withholding information, not getting tests, doing things? You know what the percentage was in 2005? It was 1 in 8 or 13%. So we now have this ironic situation where the technology is actually interfering with treatment. Interfering, because if you withhold something, that might mean you're putting your health and even your life at risk. This is action. These aren't just polls. These are actions people are taking. And so the purpose of this summit is to think about trust, think about the technology solutions that will allow privacy and enable the kind of research that we really want to transform the world. So that's enough. I know it's kind of a personal story, but I come from everything as a physician, and now it seems that we all have to come together as human rights advocates. So let's begin here with, oh, that's fine. Thank you for your kindness and for putting up with me.